Non-communicable diseases. First, we're going to talk about cardiovascular disease. A century ago, communicable diseases were the leading cause of death in the United States. Since then, the average lifespan of Americans has nearly doubled, primarily because of public health efforts and new technologies. Today, however, major causes of death, such as heart disease and cancer, come from a different kind of disease, a non-communicable disease. This is a disease that is not transmitted by another person, a vector, or the environment. Medical science has identified certain habits and behaviors that either increase or decrease the risk of many of these diseases. So first, cardiovascular disease. Your cardiovascular system transports blood to all parts of your body. Without oxygen and other materials that blood carries, your cells would die. Sometimes diseases interfere with the pumping action of the heart or the movement of blood through the vessels. A cardiovascular disease is a disease that affects the heart or blood vessels. Approximately 61 million Americans have some form of the disease. CVD are responsible for more than 40% of all deaths in the United States, killing almost a million Americans each year. Now let's talk about different types of cardiovascular disease. The heart, blood, and blood vessels are the main parts of the circulatory system. When the parts work together properly, the cardiovascular system runs efficiently. When a problem affects one part, the entire system is threatened. Keep in mind that you can reduce your risk by avoiding tobacco, getting plenty of physical activity, maintaining a healthy weight, and following an eating plan low in saturated fat, cholesterol, and sodium. First, hypertension. Blood pressure is the force of blood created by the heart's contraction and the resistance of the vessel walls. Normal blood pressure varies with age, height, weight, and other factors. Hypertension is high blood pressure that is continually above the normal range for a particular person. If high blood pressure continues over a long period of time, the heart, blood vessels, and other body organs will be damaged. Hypertension is a major risk factor for other types of CVDs. Hypertension can occur at any age, but is more common among people over the age of 35. Of Americans ages 20 to 74, 23% have hypertension. CVD, considered a silent killer, often has no symptoms in its early stages, so it's important to get your blood pressure checked regularly. High blood pressure can be lowered with strategies such as medication, weight management, adequate physical activity, and proper nutrition. Second, atherosclerosis. At birth, the lining of blood vessels is smooth and elastic. Over time, factors such as tobacco smoke, high blood pressure, and high cholesterol levels can damage the inner lining of the arteries. Fatty substances in the blood, called plaques, can build up on the artery walls, causing the arteries to thicken and lose their elasticity. The process in which plaque accumulates on artery walls is called atherosclerosis. This buildup is due mainly to food choices, specifically a high intake of saturated fats and cholesterol. Sometimes a blood clot forms in the area of plaque. The clot grows until it blocks the artery. If the affected artery feeds the heart or brain, a heart attack or stroke may result. Now let's talk about diseases of the heart. Your heart pumps about 100,000 times a day, every day, to move blood to all parts of your body. Just like every other organ, your heart needs oxygen from blood to function. When the blood supply to the heart is insufficient to provide enough oxygen, the result can be pain, damage to the heart muscle, or even sudden death. Methods for diagnosing and treating diseases of the heart and other CVDs are EKGs, MRIs, angiograph, coronary bypass, angioplasty, medications, or pacemakers. Now let's go into specific heart diseases. Angina pectoris is chest pain that results when the heart does not get enough oxygen. This pain, which usually lasts for a few seconds to minutes, is a warning sign that the heart is temporarily not getting enough blood. The most common cause of angina is atherosclerosis. Angina seldom causes permanent heart damage and sometimes can be treated with medication. Second is arrhythmias. Arrhythmia is a change in the regular beat of the heart. The heart may seem to skip a beat or beat irregularly very quickly or very slowly. Arrhythmias, or irregular heartbeats, are common. They occur in millions of people who do not have underlying heart disease, and they usually don't cause problems. However, certain types of arrhythmias are serious. In one type of arrhythmia, called ventricular fibrillation, the electrical impulses regulating heart rhythm become rapid and irregular. This is the most common cause of sudden cardiac arrest, in which the heart stops beating without warning. Without immediate emergency help, death follows within minutes. Third, heart attack. Each year in the United States, there are more than 1 million cases of heart attack, and more than 40% of those affected die. A heart attack is damage to the heart muscle caused by a reduced or blocked blood supply, usually because of atherosclerosis. Often, ventricular fibrillation occurs seconds to hours or even days following a heart attack and can cause sudden death. Many heart attacks are sudden and cause intense chest pain, but 1 in 4 produces no symptom and is detected only when routine tests are done. Most heart attacks start slowly with mild pain or discomfort, which is often mistaken for indigestion. Early detection of and immediate response to warning signs can often mean the difference between life and death. Fourth, congestive heart failure. A heart attack is an immediate response to stress on the heart. Sometimes, however, the heart gradually weakens to the point that it cannot maintain its regular pumping rate and force. The result is a condition called congestive heart failure. This condition can be a result of high blood pressure, atherosclerosis, a heart valve defect, or other factors. Illegal drug use can also bring on this condition by increasing heart rate. Strategies for managing congestive heart failure include medication and the establishment of healthy lifestyle behaviors such as good nutrition and adequate physical activity. Stroke. When arterial blockage interrupts the flow of blood to the brain, a stroke may occur. Stroke can affect different parts of the body depending on the part of the brain that is deprived of oxygen. Stroke can also occur as a result of cerebral hemorrhaging, a condition in which blood vessels in the brain burst, causing blood to spread into surrounding brain tissue. Now let's talk about why teens are at risk. The behaviors established during your teen years and early adult life determine in large part your risk of developing CVD. Even though symptoms of CVD often don't show up until adulthood, the disease itself starts to develop in childhood, according to the American Heart Association. Autopsy results of adolescents who die from causes other than CVD have revealed that 1 in 6 already had evidence of CVD. Those who had a history of known risk factors, such as smoking or diabetes, were more likely to have blood vessel damage. The health behaviors you practice now are affecting your cardiovascular system. So, what risk factors are there that you need to be aware of? Tobacco use, high blood pressure, high cholesterol, physical inactivity, excessive weight, stress, and drug and alcohol use. Now, what type of risk factors cannot be controlled? Some risk factors for cardiovascular disease are out of your control, but you should be aware of them and know how they influence your health. These include heredity. Children whose parents have cardiovascular disease are more likely to develop CVD themselves. Gender. Men have a greater risk of developing cardiovascular disease early in life and a greater risk of having a heart attack than women do. However, research indicates that older women are less likely to survive a heart attack than men of the same age. Age. As people become older, they become more likely to develop CVD. As the risk increases with age, about 80% of people who die of cardiovascular disease are 65 years or older. Knowing the risk factors you can control can help you make healthful decisions that protect your cardiovascular system. For example, if you have a family history of hypertension, you should be particularly careful to get the proper medical screenings and to practice preventative strategies such as maintain a healthful weight. Next, we're going to talk about cancer. The body's cells are constantly growing and dividing. Most new cells are normal, but some are not. Sometimes these abnormal cells reproduce rapidly and uncontrollably, forming masses of abnormal cells inside otherwise normal tissue. This uncontrollable growth of abnormal cells is called cancer. How does cancer harm the body? An abnormal mass of tissue that has no natural role in the body is called a tumor. Some tumors are benign or non-cancerous. Benign tumors grow slowly and are surrounded by membranes that prevent them from spreading from the original site. Although non-cancerous tumors don't spread, they can be dangerous if they interfere with the normal body functions. For example, a benign brain tumor may block the brain's blood supply. Tumors that are malignant or cancerous spread to neighboring tissues and through the body or lymph to other parts of the body. The spread of cancer from the point where it originated to other parts of the body is called metastasis. As cancer cells spread throughout the body, they divide and form new tumors. Many cancers harm the body because they kill normal cells when they compete with them for nutrients. Tumors put pressure on surrounding tissues and organs, interfering with body function. They can also block arteries, veins, and other body passages. So let's look at different types of cancers. Cancer can develop in almost any part of the body and in different tissues of each part. Cancers are also classified according to the tissues they affect. Lymphomas are cancers of the immune system. Leukemias are cancers of the blood-forming organs. Carcinomas are cancers of the glands and body linings, including the skin and the linings of the digestive tract and lungs. Sarcomas are cancers of connective tissue, including bone, ligament, and muscle. Now let's look at risk factors for cancer. Abnormal cells that have the potential to become cancer cells are produced every day, and the immune system destroys most of them. If the immune system becomes weakened or the number of cancer cells becomes overwhelming, cancer may develop. In some cases, normal cells change by themselves. In others, a faulty gene may have been inherited. Between 5 to 10% of cancers are hereditary. The majority of cancers are caused by exposures to certain factors that increase the risk of cell damage. One factor is a carcinogen, which is a cancer-causing substance. Examples of carcinogens are cigarette smoke and ultraviolet light. Several major risk factors for cancer are associated with lifestyle behaviors. It is estimated that about 60% of all cancers can be prevented through healthy lifestyle choices. First, tobacco use. Tobacco use is a major cause of cancer deaths in the United States and the most preventable. Recent studies attribute nearly 1 in 5 deaths to smoking or exposure to secondhand smoke. About 87% of lung cancer deaths are caused by smoking. An additional 25% of females who smoke will die of smoking-related diseases. Tobacco use also increases the risk of bladder, pancreas, and kidney cancers. At least 43 different carcinogens have been identified in tobacco and tobacco smoke. Smokeless tobacco use is a major risk factor in the development of oral cancer, which affects the lips, mouth, and throat. Oral cancer kills roughly 1 person every hour. You can greatly reduce your risk of cancer by avoiding all forms of tobacco as well as secondhand smoke. Next, sexually transmitted diseases. Some viruses, such as the human papillomavirus, or HPV, and the hepatitis B virus, cause cervical and liver cancers, respectively. The risk of acquiring these pathogens can be reduced by abstinence from sexual activity and from injecting drugs through infected needles. Next, dietary factors. Approximately 30% of all cancer deaths are caused by dietary risk factors. A diet that is high in fat and low in fiber is often linked with cancer. Fats make colon cells more susceptible to carcinogens. Colon cells divide more rapidly if the diet is high in fat, increasing the chance that abnormal cells will form. Choosing food low in fat and high in fiber reduces the risk of colon, breast, and prostate cancers. Dietary fiber speeds up the movement of waste through the intestines, so carcinogens have less time to act on cells. Radiation, ultraviolet or UV radiation from the sun, is the main cause of skin cancer. Tanning beds and sun lamps also emit UV radiation, which is just as damaging as the sun's rays. A tan is the body's response of being injured by UV rays. About 80% of skin cancers can be prevented. Reduce your exposure to UV light by avoiding tanning beds and sun lamps. Limit your time in the sun, especially between 10 a.m. and 4 p.m. When you must be in the sun, wear protective clothing and use sunscreen that has an SPF or sun protection factor of at least 15 and that blocks all types of UV radiation. Pay attention to changes in moles on your skin. We've already talked about that previous this semester about what you need to be looking for in mole changes. Now let's talk about reducing your risk. You can't control some risk factors for cancer, such as heredity, but you can reduce your risk by practicing healthful behaviors, such as practicing abstinence from sexual activity to reduce the risk of sexually transmitted diseases, being more physically active, maintain a healthy weight, eating nutritious foods, follow an eating plan that is low in saturated fat and high in fiber, protect your skin from ultraviolet radiation, avoid tobacco and alcohol, and recognizing the warning signs of cancer. Now let's talk about detecting and treating cancer. Many advances have been made in the early detection and treatment of cancer, and many more people are successfully living with the disease than ever before. The survival rate for those with cancer depends on the type of cancer and how early it is detected. Early detection is the most critical factor in successful cancer treatment. Many types of cancer can be detected through self-examination of the breast, testes, and skin. Screening for cancer is examination or testing for early signs of cancer even though a person has no symptoms. Medical screenings can result in early detection of about half of all cancer cases each year. Medical screening can result in early detection of about half of all new cancer cases each year. The current 5-year survival rate with early detection is about 80%. With regular screenings, the rate could increase to 95%. If cancer is a possibility, a biopsy, or the removal of a small piece of tissue for examination, may be performed. A biopsy is usually necessary to determine whether cancer is present. X-rays and other imaging techniques help determine a tumor's location and size. Now let's talk about treating cancer. The methods used to treat cancer depend on several factors, such as the type of cancer, whether the cancer has spread, and the patient's age and health. Treatment might include one or more of the following. Surgery removes some or all of the cancerous mass from the body. Radiation therapy aims rays from radioactive substances at cancerous cells. The radiation kills the cells and shrinks the cancerous mass. Chemotherapy uses chemicals to destroy cancer cells. Immunotherapy activates a person's immune system to recognize specific cancers and destroy them. Hormone therapy involves using medicines that interfere with the production of hormones. These treatments kill cancer cells or slow their growth. Cancer that responds to a treatment or is under control is said to be in remission, which is a period of time when symptoms disappear. Cancer in remission is not always cured. It can recur, sometimes years later.